Everybody, thank you for joining us today. I'm so excited to be here. Let me introduce myself very quickly. My name is Nadia Macucci. I'm international medical graduate from Venezuela. I'm one of the Future Petres members, and I am so excited to be here today. I was alone in the room, but I'm so excited that I have company with these amazing programs. And today, let's welcome those amazing programs. We have Boston Combined Residency Program. We have Brown University Hasbro Children's Hospital, Mass General Hospital for Children Pediatric Residency Program. We have University of Maryland. We have MedStar Georgetown University Hospital. And last but not least, University of Massachusetts Medical School. So I will be the person who will be moderating also the slides. So let me know if there is any issue and I will be happy to assist. So now let's start with Boston Combined Residency Program at Boston, Massachusetts.
Kate, why don't you start us off?
Yeah, so my name is Kate Michelson. My pronouns are she and her, and I'm here with Ted Sektish. We are the two program directors for the Boston Combined Residency Program, and we are thrilled to be here tonight and to see all of your faces and so many exciting soon-to-be pediatricians. We are program directors of the Boston Combined Residency Program in Boston, Massachusetts. We are a large residency program, and we love to be large. We have 51 residents in the intern class and about 150 residents total in the program, although the number varies a little bit based on the number of people who are in our combined pathways and in our research pathways, which we can talk about in a little bit. When asked about what the best things are about our program, the first, second, and third things are our residents who are spectacular and passionate and come to us as amazing leaders with important and incredible ideas about the impacts they want to have in pediatrics. And it is an honor to get to mentor and lead them in their time with us. We talk about having smart, passionate people, but who are also humble and funny and hardworking, and who most of all prioritize giving great patient care to our patients and families in Boston. We have a stated mission of wanting to develop the future leaders in pediatrics, but wanting to do that in a way that cultivates a diverse set of skill sets and passions. So we're excited about cultivating future leaders in clinical care, in innovation, in quality improvement, in healthcare administration, policy, public health, basic science, and clinical research. What we think makes our program really unique is that we're at two hospitals, Boston Children's Hospital, which is a huge quaternary care center with an enormous referral base, but also Boston Medical Center, which is the largest safety net hospital in New England, and a long-standing municipal hospital with an enormous social mission that we all feel really proud to be a part of. Our New England leaders did a great job of talking about what's amazing about living in Boston and New England. And I think that we want to impart our strongest desires to constantly innovate our program and to improve it, and rely on our residents to identify what the next steps are for residency training. And that we're really excited about individualizing time. Even though we have tracks, we also have an enormous amount of individualized space in our curriculum for people to pursue what they're professionally and personally most passionate about. Ted, do you want to go?
Yeah. You know, one of the things that I think attracted me to come from one residency program in California across the country to this one is that they were doing a lot of innovative things here, and it enabled me as a program director to introduce new things and try them out. And despite the fact that we introduce new things, we never think we have it right. We're always responsive to what the residents bring up and create and innovate about, and our curriculum is always changing. Right now, we're grappling with workload and duty hours issues, and we're thinking we need to transition to more of an X+Y system to enable residents to have a little bit of pace in their residency, but also be able to concentrate when they're on the inpatient parts of rotations and do more clinics when they're on ambulatory sections. This last 2 years, not only during the pandemic, but during the social upheavals that happen in our country, have made us hyper-focused on diversity, equity, inclusion, and anti-racism issues. These have become front and center in each of our executive committee meetings. We have weekly discussions about what happens to people if they feel that something has happened on a rotation where they're discriminated against or meant to feel badly about themselves because of microaggressions. And we are really taking this on at the programmatic level. Kate described some of the details of our program. We are a large program, and we think we're kind of a hard program because we have a lot of rotations. I think 30 to 40 different rotations, but we don't think we're too hard. We think that the service learning that people experience in our program is the way that they learn best. Our location is spectacular. Boston is one of the most interesting cities that you can live in. There's so many institutions of higher education, so many people that you can meet. The demographic is between 25 and 40, just your age group. So that if you're not attached and have a significant other, you're probably going to find one in Boston. So you ought to come here. And I hope that even during these virtual interview seasons that we're all experiencing, that you get an opportunity to really understand what it would be like to be in our program.
Thank you so much, Dr. Michelson and Dr. Sekchis, for sharing your experience. Now we have Brown University Hasbro Children's Hospital at Providence, Rhode Island.
Oh, hi, can everybody hear me?
Yes.
Fantastic.
We can hear you.
Good evening, everybody. My name is Pat Kwafian. I'm the Residency Program Director at Brown University Hasbro Children's Hospital. Really excited to see all of your faces and just see how much excitement there is around pediatrics, and totally agree with Kate. You guys are in the best breakout session. No, like, don't even worry about it. So let me tell you a little bit about what is special about Brown. We are a medium-sized training program in the beautiful Ocean State. We're the only children's hospital in the state of Rhode Island, and we're affiliated with the Warren Alpert Medical School at Brown University. And this really enables us to have the rigor of an academic institution with the sensibility of a community hospital. We are very sensitive to the fact that we're the only children's hospital in the state, and we understand that we have a responsibility to the children in our community. And so how our residents engage with patients feels very much like a community hospital, while we are really centered in an academic medical environment. Our residency is built on 4 pillars: clinical excellence, research, advocacy, and equity. And these pillars hold our residency up while feeding into each other. Our residents learn to give patients excellent care. They learn how to ask and answer challenging research questions about their patient outcomes. They use data to inform advocacy for their patients. And they do all of this while trying to provide equitable care, which by definition is excellent care. We offer fantastic clinical experiences in primary care, acute care, and subspecialty pediatrics. Our continuity clinics and urgent care center and emergency room are always hopping. Again, it's the advantage of being the only children's hospital in the state. Our NICU is an 80-bed perinatal center, and our interns get to work in our 16-bed PICU, which is unusual for a residency program. So we really give our residents a great deal of breadth in terms of the exposure they get to both inpatient and outpatient care. Our subspecialty providers include every discipline and care for patients across the state, including in the southeastern part of Massachusetts. And along with our residency programs, we offer 8 fellowship training programs. Our didactics still occur the old-fashioned way every morning and noontime, and cover standard pediatric topics, as well as racism in medicine and social justice. We offer all kinds of electives, including those in advocacy, sexual gender minority health, and an elective in our Rhode Island State Department of Health, which is a very popular elective with our residents. Unlike what many people imagine, I think when they think of Rhode Island, our patients are actually very diverse, which is always a surprise for people who aren't familiar with New England. The city of Providence, where we are located, is 43% Latinx and 16% African American, and our patient population really closely mirrors those numbers. 1 in 8 Rhode Islanders is an immigrant, and 1 in 5 is first generation. And our immigrant families come primarily from the Dominican Republic, Guatemala, Portugal, and Cape Verde. So Spanish and Portuguese are great languages to know if you're a physician here. In fact, residents who speak a second language can take an exam to be a certified medical interpreter and receive a stipend from our department in order to support their efforts in providing culturally sensitive and culturally humble care to our patients. Rhode Island has been a sanctuary state since 2014, and we support several refugee resettlement programs here, which adds to the richness of our patient populations. And we have a refugee health clinic right here at Hasbro, where our patients speak over 20 different languages. But what really makes our program, not surprisingly, are the residents. They are some of the most energized and dedicated doctors I've ever had the honor to work with. Each year, at least 2 of our residents are awarded AAP catch grants for all of the work that they do within our community. 1/3 of our residents have posters and abstracts that are accepted to local and national research meetings every year. They serve as mentors for 8th graders through the Young Docs program, and they were founding members of 2 affinity groups that are spread across the House staff, the Brown Minority House Staff Association and the Brown Sexual Gender Minority Alliance. And they, as 2 individual affinity groups, they really help us with recruitment and mentorship of students and House staff. Our residents also work very closely with our program and our department and GME to make sure that our environment is inclusive. And that means making big changes. We really want big changes for our clinical learning environment, and our House staff encourage us and engage with these efforts. One of the big changes was actually my coming to join the residency program. I've been doing work in racial equity and clinical learning environments for many years. And one of the reasons why I was asked to join Brown is because of that work. And so being able to work here with residents who are so energized already has been fantastic. We started racial caucusing with our House staff. We started a social justice curriculum as well as social justice elective. And our residents have just been completely supportive and willing to engage in things that are different because they know that they're going to make a difference for our patients and for our trainees. Our residents end up doing wonderful things when they graduate. They get jobs all over the country, really all over the world, in primary care and in subspecialty care. And importantly, they manage to enjoy locally Providence and Rhode Island. So they take advantage of the great restaurant scene here that's fueled by chefs that graduate from Johnson and Wales. There's a great art scene that is amazing, that's fueled by the Rhode Island School of Design. They check out all of the walking, hiking, and biking trails, and the 50 beaches that we have here. We are called the Ocean State and have actually 400 miles of coastline that we get to enjoy. Our residents are talented, they're fun, they're fierce, they're really wonderful advocates for patients, but importantly, they're incredible advocates for each other. They support each other and they create an environment that feels more like a family than a place of work. They're really empathic with one another, and it's that sense of family that is so hard to leave once you've done training here. You'll find that many of our faculty are actually previous residents who never left or left and came back. So I'm really grateful that I get to participate in their training, and I'm really proud to be a program director here.
Well, thank you so much, Dr. Poitevin. It was amazing. Now, next we have Mass General Hospital for Children Pediatric Residency Program at Boston, Massachusetts.
Great, thanks so much. And thank you again for inviting us to this tonight. This is really a wonderful opportunity. So I'm Sean Fitzgerald. I'm actually the very brand new residency program director for Mass General Hospital for Children. And I'm happy to be here tonight on actually the eve of my first day of work. So very exciting for me. I also, however, consider myself really lucky to be a graduate of this program myself. And so I'm eager to share a little bit about what is unique and exciting about the training at MGHFC. I think first and foremost, we're really a tight-knit community of pediatricians and pediatric subspecialists who are really committed to residents' sort of personal and professional growth. Our residents work with faculty who are leaders in the field and both medicine and public health and advocacy. But all of those faculty members always remain consummately accessible to residents to help them reach their own goals. And within our program, one of the ways that this takes shape is in the individualized curriculum, which really allows our residents to tailor their education to their own professional goals, whether it be in primary care or subspecialty fellowship, research, or advocacy. Clinically, Mass General Hospital for Children cares for a very diverse population from around the Northeast and the globe, like many of the other programs here tonight. And we treat a broad range of medical diagnoses from common conditions to rare esoteric diseases. And that includes pediatric trauma patients, children who are undergoing specialized care at Mass Eye and Ear Infirmary, and the Shriners Burn Hospital, which is located right next to our hospital. And we also, our residents spend a lot of time working at our affiliated community hospital as well, to really get a feel for what it's like to practice medicine in the community. The care of our patients overall, I think, is really truly driven by the residents. All of our residents receive graduated autonomy to care of patients over their time in our program, so that by their senior year, they're really overseeing care teams and directing care of patients in the ward and the clinics. And this is really the aspect of the program that I found after I graduated to be the most beneficial, and that really set me up for success in my career, my clinical career. And the residents also advance Mass General's care delivery and the overall field of pediatrics in their participation in research and legislative advocacy projects. And all of those are really aimed at improving not only the care of our patients, but also the justice and equity that they experience. I think these are themes that are emerging tonight that I think are really important ones, and ones that are taking front and center at the greater institution of Mass General Hospital, but most definitely within our residency program as well. I'd like to turn it over to Danielle Lerner, who's one of our current chief residents, to provide some further level of detail about our program.
Hi, everyone. I'm Danielle. It's a pleasure to be here and an honor to serve as one of the chief residents for the MGHFC program this year. I just wanted to share two highlights with you all about the program. The first is something called the longitudinal curriculum, which is a curriculum and a protected academic half day for our residents every week. And there's something very special within that called PPD, where residents get to come together and bond over the challenges of residency, the rewards of the day-to-day. And it's really kind of a special time once a month within the longitudinal curriculum, and the other weeks are reserved for different teaching sessions, procedural work, sim training, and all kinds of different opportunities for learning and furthering our education. And the other thing that I want to focus on is just the strong sense of community and camaraderie among residents and among faculty, which is so special at MGH. One of our mottos is to never worry alone. And I think there really is the sense that everyone is in it together and working together. Our residents are always helping each other out, and when not in the hospital, spending a lot of time together, doing all kinds of fun social events as well. So those are two of my highlights. I'm now going to turn it over to my wonderful co-chief, Elle Young, to share some of her highlights as well.
Thanks, Danielle, and thanks for having us here today. Two of the big reasons that I chose Mass General for my clinical training, I think the first is really the breadth of clinical training that was available. I remember as a medical student coming across the case records of the Massachusetts General Hospital and loving the pediatric cases in the New England Journal of Medicine, and really realizing that as a resident at Mass General, I'd have the opportunity to actually care for these patients with incredibly fascinating, often really complex diagnoses. But in addition to also caring for patients who often present directly from care from all corners of the globe, often even just hopping off the plane at Boston Logan and coming directly to Mass General for care, which I think was perfectly balanced by the opportunity to actually have community pediatric experiences in our community hospitals as well. And I think the second reason that drew me to Mass General was the focus on diversity and equity. As an underrepresented in medicine candidate, I was really looking for a program that valued myself as an underrepresented in medicine candidate, but also the local community as well, and coming together to really organize to work towards replicating these injustices, kind of facing the country and local communities as well, and working together. Mass General, our hospital, has a larger Center for Diversity and Inclusion that includes all of the URM residents and allies as well. And within our program, we also have the Diversity, Equity, and Committee that consists of URM residents, but also allies who are interested in organizing together. And recently, our projects have included starting a health equity rounds, also doing an advocacy cause of the month, and more recently, organizing RF Dash, which is a Massachusetts day at the State House, which is led by Mass General residents and teaches residents how to actually advocate for bills and work with our local governors and senators to actually make those changes happen. So thank you so much. And we look forward to seeing all of you on the interview trail.
Thank you so much, Dr. Fisgar, Dr. Lermer, and Dr. John. It was amazing. Now we have University of Maryland at Baltimore, Maryland.
Thank you. Hello, I'm Erin Gaitis. Can you hear me okay?
Yes, doctor, we can hear you.
Fabulous. So I'm Erin Gaitis. I'm the Pediatric Residency Program Director, and this is actually my 16th year running the Pediatric Residency Program here, and it is a whole lot of fun, something new every day, especially during a pandemic. So I really enjoy getting to work with a wonderful, wonderful group of residents. So I'll talk to you about a number of different program highlights, but I think I really would highlight the wonderful quality of residents as far as clinical care, and just residents who are just good-hearted, kind human beings who want to make a difference in the world. And I feel lucky that I get to work with them every day. So to do some of our program highlights in particular, we have a really big focus in our program on individualized education. We actually have lots of opportunities for our residents to make their own way. So they can design their own electives. There are lots of different individualized electives that they design each year. One of my residents just recently collaborated with others in the hospital to make a hospital administration elective that was new and different than had been done before. She made it for pediatrics and also for the whole rest of the hospital. And there are many other opportunities for individualization. So making your own electives with help of faculty, and then also being able to choose clinical pathways and longitudinal tracks at the end of your intern year. So I always highlight that at the end of intern year, you're allowed to just be an undifferentiated pediatrician for your first year while you're figuring out what you want to do. But at the end of that year, you have 2 different opportunities to really specialize your education based on your particular interests, both in where you think you'll go career-wise and also other areas of particular interest that you'd like to spend a little additional time on in residency. We have a real focus on wellness in our program, which has been the case for a lot of years. And we really have, in the last several years, enhanced that. I've been really excited to be able to partner with others in our hospital. So our program, our individual residency program, is a medium-sized residency program, but we actually have over 900 residents and fellows in our University of Maryland hospital. And so we have a greater institution to draw on for a number of things, including wellness initiatives. So I've been really excited to partner with one of the heads of the hospital in the last year to help roll out some of the things we had been doing around wellness and resiliency just for our residency program across the entire institution. So that's been a lot of fun. Some of the things we make sure to do for our residents is to really pay attention to their schedules. I think that's actually really important. Making sure that they are well means making sure that they have adequate time for rest. If they're a couple in a program, we try really hard to match up their vacations together. If they're couples matching in, things like that, I think make a difference for residents. Diversity has been a really big emphasis in our program, diversity, equity, and inclusion. In particular, in the last several years, I've been really proud of the wonderful efforts of our residents. We have a really great group of residents who have been really helping, along with several of our passionate faculty and lots of other faculty, to spearhead a new and improved Pediatric Diversity Council, which has been in existence for a while in our program, but we really rejuvenated things in the last several years. We have 3 very active subcommittees and a new and wonderful social justice curriculum that we just finished the first year of. That includes our health equity morning reports, monthly noon conferences, and at least quarterly grand rounds specifically devoted to diversity. I'm noticing as I'm looking at Dr. Poitvien right now, who is the program director at Brown you just heard from earlier. She actually was a special speaker for us this year. She came as an invited lecturer for our one main pediatric education lecture of the year to talk specifically about diversity initiatives. So that was really wonderful, and I've been really excited about the additional energy that generated as well. Thank you again, Pat. And we also just finished our first year of our Do the Work anti-racism small groups, which are groups of medical students, residents, and faculty working together in small groups to really tackle these challenging issues. And I have had some wonderful conversations with residents in the small group that I've been in. It's been just a really fabulous opportunity to be honest with each other and to continue to grow in the ways we all need to in this area. So I'm really proud of all of those efforts. And we really are very lucky in Maryland to be living in an area that is incredibly diverse. Our patient population is incredibly diverse, and we have lots of opportunities to make a difference in our patients' lives every day. It really is like a family here. Hopefully you'll get the sense of that if you come and spend a whole day with us on interviews. We really get to know each other well. I think the size of our residency program really allows our residents to get to know each other very well. We have a medium-sized residency program. You can see in our details there the numbers. We have 15 categorical residents per year, so 45 pediatric categorical residents. The addition of 26 combined residents takes us to a total of 71, which means I think I put us in the medium-sized category. You all can decide what you think if you come spend more time with us. But I think that's a really nice size to get to know each other well. Our graduates go into primary care, fellowships, hospitalist practice. They do fabulous things. They go on to run residency programs and do great things with advocacy. I'm really proud of what they're able to do. And they keep in touch with us, and many of them actually come back and join our faculty, which is exciting. Baltimore is a really fun place to live. I would encourage you to explore more about it. Maryland is known as America in miniature, meaning that we have all the different things in the country here. Within 2 hours of our program, you can both go skiing in the mountains in the winter and go for a beach getaway 2 hours away in the summertime. I just got back from one of those myself, and it was fabulous. So there's really lots of things to do close by. Also right here in downtown Baltimore, where we're located, there's wonderful waterfront dining, fun nightlife. We have lots of sports and lots of arts and fun things to do. So we really welcome you to learn more about us on both our website, also our Instagram, and hope to get to talk with you all more soon. And hopefully we'll get the chance to chat with some of my awesome residents that are joining us tonight. Thank you.
Thank you, Doctor. That sounds amazing. And thank you for your participation. Now we have MedStar Georgetown at Washington, D.C.
Hi, good evening, everybody. My name is Kirsten Hawkins, and I am the program director at MedStar Georgetown. I've been the program director. This is my 7th year. It's amazing to see how quickly the time flies and to see other colleagues here and some new colleagues that we haven't had the chance to meet yet due to COVID kind of changing a few things the last few years. In any event, we are a smaller program than Maryland. We have 33 categorical residents, so 11 per year. We also have a medicine pediatric residency that we're very closely affiliated with 4 per year. And we only have fellows in our NICU. So it's really a resident-driven program and amazing experiences where you're working one-on-one with your attending on a daily basis. And I think a lot of great opportunities for our residents. Of course, living in the district has lots of fun in different ways, and it's been a very interesting place to be in the last 4 years, definitely. But it's really incredible. And because we're such a I'm going to say small city in many ways, large but small, you really get to know your peers who are in other programs. We are very closely affiliated both with the Inova Fairfax residency as well as Children's National Hospital here in DC. We partner with them on different rotations and have great working relationships with our local pediatricians and a very, very active DC chapter of the American Academy of Pediatrics. We do also, though, make sure that our residents have experiences not just in a tertiary care center, but also in community hospitals, both in Virginia and Maryland, and feel that we really do an amazing job of letting our residents grow and experience different things. And so really letting them kind of figure out what's best for them and where they want to be and what they want to do. A good portion of our residents do go on to fellowship, though some stay and become general pediatricians or hospitalists. And it's actually amazing to see how many come back or stay on as faculty members with us here in DC. We have a really unique patient population in the district, both with an immigrant population, an international population with everything from refugees to World Bank and International Monetary Fund and different embassies that are within walking distance to our continuity clinic. And so it's a pretty incredible experience to see how all of our patients are seen in just one clinic. In terms of our curriculum, we have an academic half day that we are in the second iteration of, where it's an 18-month curriculum, and it's been really well received by our residents as well as our faculty members. It's been obviously a little bit different via Zoom this year, but an opportunity for all of our residents to spend time together and release from clinical services so they can really focus on their education. We do have 4 different tracks. You don't have to decide when you're coming in. You can decide once you're here. We ask towards the second half of the first year, focusing both on global health, community and advocacy in the district, quality improvement, and our research tracks. In terms of our diversity initiatives, we're part of MedStar, which is a 10-hospital large medical system in the DC metro area, encompassing Maryland, Virginia, and the DC, with over close to, I think, 1,000 residents. And so even though pediatrics is one small part of that, we have all of the opportunities of being in a larger health system. And so pretty amazing diversity initiatives that are both through the university at Georgetown, as well as through MedStar, some of which are led by some of our own pediatric faculty. And one of our pediatric residents is actually the resident co-director for the entire initiative for the health system this year, which is super exciting. We also have I'm going to say other opportunities because we're in the larger system to take advantage of other hospitals and different experiences. And then being in DC, taking advantage of things like the American Academy of Pediatrics legislative branch in the district or our health department clinics. So lots of different things where residents can really self-direct their learning and choose what they want to do and focus where they want to be. Of course, being in the district metropolitan area, we're in the city, but it's a very livable city and easy to get to other places. I would have to probably, I'm going to say, compared to Boston in some ways, Dr. Sektish's comments about lots of 20s and 30-year-olds who live in the district, and makes it a pretty fun place to be with a great restaurant scene. And then, of course, not too far train ride or bus ride to New York or other places. I also wanted to focus a little bit on our mental health and behavioral health curriculum. And I have our associate program director, Elizabeth Chawla, who's with me tonight, who's going to mention briefly about that.
Hi, everyone. I'm Dr. Elizabeth Chawla, and I'm one of the associate program directors. I'm actually a graduate of our residency program at Georgetown, and I've been on faculty now there for about 8 years. I also went to med school at Georgetown, so they sort of joke that they can't get rid of me. I've been here for a long time, but Georgetown really is a great place to work. And as Kirsten said, there are many other members of our faculty who have been at Georgetown for a long time. It's a place, it's very family oriented, and people are sort of there for many, many years. Also, I just wanted to very briefly mention a couple of our strengths, one being that we have a very robust continuity clinic. And so it's resident run, a large academic continuity clinic, which I think is different than some other programs. And that helps our residents to be very well trained in general pediatrics, whether they want to go on to primary care or a subspecialty fellowship afterwards. And part of that is we have an integrated mental health clinic embedded in our continuity clinic. As most of you probably are aware, mental health problems for children are huge in the US and only increasing, especially during COVID-19. And so lots of residency programs are coming up with very innovative ideas around how to do a better job of educating residents on how to take care of patients with mental and behavioral health issues. And we have a really comprehensive mental health curriculum at our program that takes advantage of some really unique opportunities that we have. So I think it's a real strength of our program. And in the interest of time, I'm going to pass it on to the next group. I want to make sure everybody has time to present.
Thank you so much, Dr. Hawkins and Dr. Chowlan, for your amazing participation. Now we have, last but not least, University of Massachusetts, Worcester at Massachusetts.
Hi, everybody. Thank you, Nadia. Thank you, Future Peds Res, for having us here. Very exciting. Thanks for all the students who are showing up tonight. This is a really exciting time of year where you're trying to figure out the highlights of these different programs and what the right fit is going to be for you. And we're excited to meet all of you guys and get to know you a little bit better. It's always exciting to kind of look at all the applications and kind of think about as we go through interviews and hearing the students' interests and everything, kind of feeling whether UMass is going to be a good fit. And I think it's a great fit for a lot of people. So I'm happy to be here to be able to tell you a little bit more about our program. So just first, a quick word about clarification. So you'll see another UMass program, not in our chat room here. I think they're in chat room number 2. So there's also a UMass Bay State program, which is in Springfield, Mass, a little bit further to the west of us. UMass Memorial Medical Center, which is the program that I'm representing, the Children's Medical Center at UMass Memorial Healthcare, is located in Worcester, Massachusetts, and is affiliated with the University of Massachusetts Medical School. So this is Worcester is right in the heart of Massachusetts, right in the center of the state, and as such, it's really the kind of main children's medical center that serves central Massachusetts. So the mission of UMass Medical School was to create a training location that was going to train the next generation of caregivers to take care of the population of central Massachusetts. And it's a big catchment area. So our catchment area extends all the way into southern New Hampshire to the north, to parts of northern Connecticut and northern Rhode Island to the south. We kind of extend all the way west near Springfield, Mass, and all the way kind of to the outer suburbs of Boston. So it's a big catchment area. And as a result of that, we serve an incredibly diverse population of patients. And that's from an ethnic, racial, religious background, socioeconomic background. Worcester is the second biggest urban center in New England, but it also, central Massachusetts has a massive rural population as well. So it really is an incredibly diverse population that we serve. We're the only level 1 pediatric trauma center in central Massachusetts. We're the only level 3 NICU in central Massachusetts. So we really see a whole breadth of different medical issues that come in. And you know, along with the diversity of patients that I mentioned before, we also see a really diverse medical complexity that comes through our doors. So it's a great place to train. The one thing that I think is pretty unique about UMass is that we're because we serve this big catchment area, we have essentially all of the pediatric medical subspecialties represented and most of the pediatric surgical subspecialties represented. But in contrast to most programs that have that breadth of experience, we don't have the fellowship programs that go along with that. And what that means is that even though your primary pediatric training is kind of primary care, primary pediatric based, you really get a robust training with respect to the subspecialty care as well. Our residents, because there's not a lot of fellows running around, you really get that apprentice style teaching when you're doing, for example, I'm a pediatric cardiologist in my day job. And if you're doing a pediatric cardiology rotation with us, you know, we really treat you like a pediatric cardiology fellow. You're out there, you're seeing the patients in the NICU and the PICU and out on the floors, and then kind of coming up with your own assessments and plans and running it by us. So we really, throughout the department, we really give our residents rotating in the different services a lot of autonomy with respect to the responsibilities that they're given. A word about our primary care experience. Again, kind of UMass Medical School is kind of, again, founded with a primary care thrust. And the primary care experience is fairly unique. Some other programs you'll see run things this way too. Rather than having a central kind of resident hub within the medical center where all the residents do their primary care continuity clinics, we actually partner with a lot of different pediatricians out in the community. So some of those primary care practices are right in the heart of Worcester. Some of them are out in those rural communities that I mentioned, elsewhere in central Massachusetts. And we go through a mini match process where incoming interns are kind of matched with primary care preceptors who have either similar backgrounds or similar interests, so that we're confident that when that intern comes into that primary care setting, they're really going to feel comfortable with their preceptor and with the experience that they're going to get. And part of that intern year, about halfway through the year, we have the Our Town experience where all the interns get together and they kind of compare notes. They go out into their local communities and they learn about what are the local resources that are available to their patient base, what are the public schools like, what's the WIC program like, et cetera. And then they all get together and they kind of compare notes so that they get a real good feel for what the different communities are like in and around Worcester, so that then when they're in their inpatient rotations, they really get a good feel for where all these patients are coming from. So that's a really neat experience. The way that we do mentorship might be a little bit different. So we do mentor families, which consist of 4 faculty members with a PGY1, a PGY2, and a PGY3 resident. The faculty members are usually a mix of primary care and subspecialty faculty. So we kind of ensure that any given resident is going to get a good exposure to kind of a breadth of different knowledge and experience from the faculty members, and also get mentorship from their peers as well. As an intern, you're going to get mentorship from that PGY2 and PGY3 resident as well. Part of the function of the mentor family is to work on an individualized learning plan, which is a way to kind of make sure that as you're going through residency and just kind of, you have your nose to the grindstone, kind of living your out, trying to survive on the wards, for example, but that you also kind of take a step back and think about what your career goals are like. What is it that gets you up in the morning? What do you enjoy about your job? Okay, well, if you enjoy the continuity of care, maybe you should be thinking about a career in primary care pediatrics or something else that has that continuity or whatever. The idea is to kind of make sure that you don't lose the forest for the trees as you go through training, and the individualized learning plan is a tool that your mentor family will help you kind of develop, so that you kind of keep your good career goals in mind. Education is a focus, as it is with all of the programs that you've heard about tonight. We have a special resident as educator track within the residency program, and some of our recent residents have done a lot of really good work with making, with kind of enhancing the curriculum for that. So that's something that we're really excited about. And since we're coming up on time, I guess I'll wrap up by saying that I think of UMass as kind of a right-sized program. It's big enough that it has all these different subspecialties represented and a lot of different expertise, but it's small enough that everybody's on a first name basis, and everybody knows each other really well. Everybody has their cell phone numbers and is texting one another, and it's a very collegial place to work. So with that, I'll write up. I hope to see a lot of you guys on the interview trail this season. And again, very exciting time of year. Thanks for having us.
Thank you so much, Dr. Fahid. Thank you for all the programs, faculty, residents, for your time and support. Now, I think we ran out of time, but we will happy to have all of you guys to the breakout room for the questions and from the wrap up session. Thank you again for joining, and it was very nice to see you all here.